What's the difference between your plan and Medicare for All? Why is it better?
It's very different, and it's much better, if I do say so myself. First of all, it has a great name, Medicare X. But look, there are a lot of people in America who are making too much money to be on Medicaid, and they're not making enough money to afford health insurance. There are millions of people that are in that category. My bill, Medicare X, creates a true public option administered by Medicare. So it's not Medicare itself. I want to come back to that. Administered by Medicare that would allow everybody in America to decide for their family whether they wanted a public option or whether they wanted to hold on to the employee insurance that they have. It puts the choice in the hands of American citizens who may have different points of view about what they want. Medicare for All is the opposite of that. Medicare for All takes insurance away from 180 million people who get it from their employer. It takes Medicare Advantage away from 22 million Americans. 120,000 Iowans would lose Medicare Advantage as a result of Medicare for All. Medicare for All. And so I think it's very important for the Democratic Party to be very honest going into this election about what we're for. If we're for Medicare for All, we're for taking it away from 180 million people before they get it again. And in fairness to Bernie, he replaces it. So, you know, it's not as though there's not anything there, but it's the government deciding what your insurance is. And we have to raise taxes massively in this country to pay for it. My option, we don't have to raise taxes for, and we can still get universal coverage. That's a big, big difference. Somebody described it today as a nuance. There's nothing nuanced about almost 200 million people having to go on a government plan just because Bernie Sanders says it's what everybody should have.
You mentioned others in your party, but they argue that there can't be universal health coverage if for-profit insurers make their money from taking your premiums and then